Hello and welcome. I'm Kalpana Singhal, founder and chief editor, CXO TV, our flagship brand of Techless Media Group. And today we have with us a very special guest, Mr. Sreeni Venugopal, Group Chief Information Officer, Kim's Hospital, for this very interesting fireside chat. A very warm welcome to you, Mr. Venugopal.
Thank you. Thank you, Kalpana.
Thank you so much for joining me. Okay, so when it comes to healthcare, say few years ago, we were talking about electronic health records. Linking with the UHID, the unique health IDs. So, what is the kind of adoption you have witnessed over these last couple of the years when it comes to using such technologies?
Yeah, over the actually that is absolutely correct, because over the last 2 years, when the government of India launched the Ayushman Bharat Digital Mission, and that, by the way, is a great initiative. It aims at bringing all these hospitals together in one common platform, and the government has set up, from a technology perspective, they have set up sandboxes that we as hospitals can connect to in order to test the readiness of our hospital information systems in the change scenario for the government of India. Also gives us the ability to try and see how patient information can be shared across different other hospitals as well. So when you look at it from a technology change standpoint, it calls for changes in our hospital information system, and that's something that we are doing as we speak. From a service standpoint, there will be a much larger impact to patients because it gives patients the ability to control their data. So patients can decide what medical information should be open to which hospital at what time. And the IT systems need to support that kind of decision making by the patient. So those are two areas where we are making changes to our architecture and our health information systems.
Yeah. So home care, telehealth are the kind of solutions which can actually help dealing with this challenge of low number of beds.
And in fact, it's also the fact that, if you look at statistics again, like I said, it's around 5 beds per 10,000. But if you look at number of doctors, we have, I think, around 9 doctors per 10,000, which is not very bad. So it's that we don't have the infrastructure, but we have the ability to provide care, and which is where remote services will help. Another example also, Kalpana, is where we have implemented a tele-ICU solution where for the smaller healthcare centers and smaller hospitals that we own, our intensivists, who are the ICU doctors, who are the experts, can remotely see, treat, and advise care for patients in the smaller locations. We even try to look at using this solution for smaller healthcare centers, right, where they don't have right skill expertise. Again, so you can use an audio-video solution, you can use monitoring solutions, all of which are IT solutions to provide that expert healthcare from hospital to hospital, not even necessarily hospital to patient.
So what about the universal health portal, which is much required for the patients to find out which is the best hospital available within their vicinity. So when it comes to technology, like universal health portal is again a part of it. So what is the kind of scenario now? Like it was in talks. So how fast is adoption?
It will come as part of the ABDM or the Ayushman Bharat Digital Mission itself. So there are two parts to it. One is the policy and the process that needs to be implemented, including healthcare providers, both private and government, insurance companies, then the government and other organizations that provide healthcare in between. And again, not only allopathic but also Ayurvedic and the others. So that's more of a larger universal idea and initiative, right? The second part to it is a technology, because there has to be a certain amount of standardization of the technology, the processes and the messaging that you use between systems and so on. And that is being defined by the government. So the government has defined the architecture, I think it's 3 or 4 tier architecture on how the universal health portal will look like. What should be the underlying health information systems that hospitals should adopt, and what are the different APIs and integration methodologies that the system should provide upwards to the portal. So at the high level, the patients with a universal health ID will log into the government portal, from which they have access to the treatment plans available and the care options available from different hospitals, and then they can pick and choose. And that puts power in the hands of the consumer, right? In the hands of the patient, where they can choose which hospital they want to go to, which kind of care they want to take. And I see in the future that these platforms will allow, or will also allow, hospitals, their experience and the treatment to be rated, where patients then can see that this is an excellent hospital that they want to go to, which puts a lot of onus on us as hospitals to make sure that we are providing good treatment, because it will now become, it will be very visible now, as compared to earlier, where there was no high level portal for this.
Okay, so the flight has yet to take off when it comes to.
Yeah, it's set to take off. I mean, it's very much in on the cards. There is a lot of definition that has happened. There are many documentation, many documents available, circulated by the government, and it's well defined, but it's yet to take off.
Yeah. So, as healthcare groups are focused on building a resilient healthcare model and future-ready hospitals, what, according to you, are the cost, risk, and rewards involved in building a future-ready hospital, and how crucial is the role of technology, it is playing to make hospitals future-ready?
Technology plays an immensely important role in this, and I mean, if you look at any industry, not necessarily only healthcare, most of the new changes and what we call as game changes in the industry will come from technology. So in one way, it is the fact that technology and technology solutions will drive future healthcare models. So when we talked about remote healthcare or home care, for instance, that will become more prevalent in the future. People, even today, if you look at how people consume goods and services. People use Swiggy much more than going out and eating. Medicines are always ordered, and Amazon is booming because people like to order and get things at home and to enjoy that in the comfort of their home. Healthcare is no different. So there will always be a trend towards that. So which means that to be future ready, we need to make sure that we are able to cater to that increasing clientele that wants healthcare delivered to their homes. If you look at it from a cost perspective, Kalpana, then costs are quite high. I'll look at the monetary cost first. So most of the new solutions, either using artificial intelligence and machine learning, or very specialized equipment with a certain high degree of accuracy, all of these are very expensive. And most of the equipment that are used in hospitals are long-term investments. These equipment work for 15, 20 years. And then if you need to refresh that and bring in equipment that allows digitization and integration and the digital transfer of data to be connected to the cloud, then that calls for a large investment from the hospital side. Coupled with that also is the lack of good skills in the market. So we struggle to find either IT experts or even technologists who can work in this environment and work with these devices, because a lot of these are IoT enabled technologies, and finding the right skill set for that is quite difficult. So from at a very high level, it is an expensive call, and one needs to look at it from a long-term perspective. There are a number of risks that come with it. Okay, one of the risks is that the amount of personal attention and care will reduce as you go into more home care based solutions, because healthcare has traditionally been in a place where there is always one-to-one interaction. The other side is that there are many new technology solutions in the market, mostly driven by AI, and AI is a black box. So you test for this by looking at clinical accuracy, but again, there are possibilities where the diagnosis is wrong. Who takes responsibility for that, right? And so that's a risk that the hospital carries when you start moving from people-based to AI-based solutions. More than that, when you look at you talked about the the universal health portal and the integration between hospital systems. Such open architecture always brings in security risks. So which means that now we have to always make sure that our systems and solutions are very well protected as we move more towards the cloud. When we start integrating with other hospitals, when we start integrating with the government portals, your attack surface increases drastically, and that's a big risk that we carry. Then you asked about rewards. Now, from a reward standpoint, of course, much increased, larger customer base. Now you are not constrained by geography. Sitting in our hospital in the south, so the south part of India, I can treat anybody across India or anywhere else in the world because the technology exists for us to be able to do that. So that's one of the things. There will be more involvement from patients as well as their relatives in the care process. One very interesting thing that we saw is earlier, our hospital is in Kerala, and we have a large aging population in the state, and their children are all abroad, either in the US or UK or somewhere else. And the children are never able to participate in the treatment process for patients. But when we moved into a teleconsultation methodology, the children could also log into the doctor consultation and be part of the treatment plan, right? So technology gives that a side benefit that was not something we thought about, but it just made it so much easier and comfortable for the patient to use that technology. So these are some of the things that then come as rewards from a patient perspective. And of course, accountability, better accountability, less error in tracking of medicines and such, and then higher revenues and so on. That comes as rewards from that standpoint. But from a technology standpoint, we will see that artificial intelligence based technology, IoT based technology, all of this will bring in better patient care, more patient safety, and better reach to our patient base.
Yeah. So then, how are we dealing with that cost burden? I mean, is it that the entire cost burden of these expensive technologies is going to be borne by the patients, or what exactly hospitals are doing so that the entire burden is not being shifted to the patient?
Absolutely, and that's an extremely good, it's a very good question, because that is something we worry about too in the hospital. When we say that we need to make that investment, then the money has to come from somewhere, right? So particularly in these areas, we try to balance what we need to invest in. So if it's equipment, we look at solutions where existing equipments can be enabled to be connected to such technology solutions, right? Instead of having to buy the latest and the greatest model. That is one way. We look at collaboration within the industry. So are there diagnostics labs that are doing these kind of activities? Can we tie up with them where they have the equipment, and then we outsource the diagnostics to them? But then we have our own AI ML solutions in house that does the analysis of the outcome. So there are a number of ways we look at that. We also see that similar to the cloud model in IT, we are also seeing that that there are subscription models in the medical in the domain as well, where you do not need to make a high capital investment upfront. And that's another way that we look at reducing the burden. And some we always take on ourselves as in terms of research and development, or the fund that we keep aside for such investments. So not everything gets passed on to the patient. And we look at balancing to only invest when it's absolutely necessary, and also try to collaborate with other players in the market.
Yeah. So, what about the skill gap? Like you're also talking about that it's difficult to find people who already understand how to use IoT-enabled devices and technology as a whole when it comes to. So, how are you meeting with these challenges? Whether it is a skill gap or it is having new people in the system?
It's a combination of a number of things. So one, like you said, it is just new people that we train and we build from the hospital or through our training in technology. That's one way to look at. The other way is to work with partners. So we have partnered with 2-3 different companies in the market who who are experts and who specifically deal with this area, which is IoT in the medical space. And so we work with them where they bring in the skills and they provide the services back to us, because it's difficult for us to recruit and retain them. An area where it usually becomes difficult is if we are doing some research and development, and we are doing, for example, if you look at predictive analytics and looking at our 20 years worth of data to find out what other diseases could our patients probably get, and what kind of intervention should we do now, so that they are those are addressed before they actually show up, right? This is very sensitive information, and it's also proprietary to us, and there we do not want it to be very open from an outsourcing perspective, and there then we need to look at the market and hire people with that expertise, and at times paying much more than the market, because that's the only way you can get people to come in, and giving them the opportunity to work on this challenging project. So a number of ways, partnering with expert solution providers, some that we hire and some that we build and train ourselves.
So any specific criteria while identifying these partners?
Mostly who have, partners who have expertise or experience in the healthcare sector. For us, domain is very important. And again, as an answer to your very first question on technology, I have realized over the years that domain is more important than technology when it comes to providing outcome. So for the partners, domain is very important. We look at partners who have an understanding of the medical domain. So I'll give you an example where we have implemented solutions for patient safety, where around 1 in 6,000 operations, you end up leaving something inside the patient, maybe a surgical gauze or a piece of cotton or something, right? And that's a huge patient risk. So we had our partner come and build a solution for us, which tags all of our surgical equipments, and then using an IoT solution, and then it's always scanned, and we make sure that when a patient goes in for surgery, everything that went in for the surgery also comes out, right? And that's a technology solution. But in order to explain that to a partner and get them to build it, they need to have that knowledge themselves. So the partners we work with have doctors on their staff. They have radiologists on their staff, and they have these kind of surgeons on their staff who understand the business need. And that's one of the criteria that we use when we select the partners. And number two, of course, then is the technology space. What kind of expertise do they have in technology? And three is the cost angle, because most of the solutions that are built for international market is prohibitively expensive for us. So we always look at solution providers that can build themselves, or who have an ability to build more value for money products for us.
Yeah, absolutely. So what kind of technologies you are using at KIMS when it comes to preventive healthcare, to actually make people more aware of preventive healthcare? So what all things you're doing? Any initiatives around that?
Yes. So that is more process and people initiatives than technology. But however, we use technology as a medium to promote it. So I will look at it from two angles. One, it is we run a number of health camps in different offices, in hospitals, in areas, along with the government and in schools, etc., which promote the way of life which is healthier, and also educating people about the perils of not following that kind of healthy lifestyle and what it would mean at the end, right? So that is one thing that we do. Second is we use social media quite extensively to promote that. And the third thing is we use our mobile app itself to promote healthy living and healthier lifestyle. That said, usually this is a very it's a very important area, but not well addressed, I would say. And we are looking at ways in which we can take technology. We can use technology to address that. I would say that we are not there yet. Because there is a lot that can be done in that space.
Yeah, of course. Especially, the focus is towards communicable diseases instead of NCDs, non-communicable diseases.
Yeah.
So a lot of awareness is required. So when it comes to your app, so how's it? Like, is it also sending some kind of newses or blogs? How it has been, created that people can actually get some notifications. If you can brief us a little bit about it.
Sure. Yeah. So based on the care plan that the patient is on, and the kind of medicines that have been prescribed, there are reminders that come up whenever it is time for them to either meet the doctor, or B, when it's time for them to refill their medicines, or take their medication. Right. So that's one of the things that helps make sure that people adhere to the care plan that has been prescribed to them. From a wellness perspective, it does provide news and information through the app. But more than that, we run certain online, I should not call it training, but awareness programs for our patients. So when they come in for, let's say, for example, when we have patients who come in, or when they have to, when they're pregnant, and they're coming in for care, and they have another 6 months to go. So then we have a lot of online awareness programs that we conduct for these patients, through which then they know what to do, and how to do things, and so on. When there is rehabilitation to be done, again, we have packages that allow that rehabilitation, which is not on the app, but it is done through our platform for providing this information. A third point also that I would like to mention is, we tend to look at it a little holistically. So if we have a patient who has come in for a knee replacement surgery, or who's come in for a medical procedure that's done in the hospital by allopathic care, we also have an Ayurvedic department that helps with post-operative care, because then we try to make it more wholesome, rather than only a very prescriptive methodology of care.
Yeah. So is it that they can also make payments through this application?
Yes, very much so. It's completely digital, so you can make payments. One use case that we used there was, usually when people come in and for outpatient services, they meet a doctor, they're prescribed a set of medicines, then they have to go to the pharmacy counter, and then where it's completely digital, it's completely EMR. So the pharmacy sees their prescription, they fill the medicine prescription, and they give it to the patient. Then the patient has to pay for it, pick up, and go. And that usually takes a long time. It takes some 10-15 minutes to get the medicines and go. So in the mobile app, as soon as the doctor prescribes the medicine, it appears on the mobile app. The patient can see it. They can select which medicines they want, and they can make certain changes if they want to in terms of quantity. They pay for it, and by the time they walk to the pharmacy, it is packed and ready, so they can pick up and go. So those are some of the no contact things. Yeah, some of the things that we implemented. Yes.
Yeah, the best patient experience one can have.
We try to. Yeah.
So thank you so much, Mr. Venugopal.
Thank you.
Interacting with you. So with this, I want to thank everyone for joining us. Thank you, everyone, and please, to watch more such interesting videos, please log on to www.cxotv.news, and please stay tuned to our social media channels. Stay safe and take care.
For more updates from CXO TV, please like and subscribe to our channel.